Cholelithiasis, gallstones. Gallstones are pieces of solid material that form in the gallbladder, a small hollow organ located beneath the liver. Gallstones form from hard deposits in digestive fluid. Many people never have symptoms. Sometimes, gallstones can block the upper bile duct called the cystic duct, causing pain. If the gallstones are left untreated, the cystic duct may become blocked, leading to painful inflammation of the gallbladder and nearby pancreas. Although gallstones can sometimes become dislodged from the cystic duct on their own, often a surgical or endoscopic procedure is needed to remove the gallstones. There are two approaches to remove the gallbladder, either open or laparoscopic surgery. During an open cholecystectomy, a single large incision is made in the abdomen to directly remove the gallbladder. During a laparoscopic appendectomy, several smaller incisions are made in the abdomen. Tiny surgical instruments locate and remove the gallbladder after cutting and tying off the cystic duct and nearby cystic artery. Port placement. In preparation for laparoscopic surgery, 4 ports are placed in the abdomen at the umbilicus, belly button, and on either side of the gallbladder near the lower edge of the liver. The ports are hollow channels that provide access for a small camera called a laparoscope and various surgical instruments. Locating and retracting the gallbladder. The laparoscope is a small surgical camera with a light source that initially locates the gallbladder. After the gallbladder is identified, 2 grasper surgical instruments retract the gallbladder and liver upward in order to better access the cystic duct and artery. Clipping and ligating the cystic artery and duct. Clips are placed on both the cystic duct and artery to ligate, close, them. Removal of the gallbladder. Surgical scissors then cut the cystic duct and the gallbladder is removed from the body.